What if I told you your anxiety might be making you a better doctor, but it's also slowly burning you out? You can catch rare diagnoses, anticipate problems before they happen, yet you're laying awake at 2 a.m. replaying the decisions you made earlier in the day, and obsessively checking lab results at all hours. Here's the thing, that's not normal. It's high-functioning anxiety, and it is everywhere and normalized in medicine. A national survey shows that most physicians report severe burnout or stress, and research confirms that doctors face anxiety and depression at much higher rates than the general population. We're going to talk about that in this video, and we'll explore why medicine breeds high-functioning anxiety, what's happening in your brain when it takes over, and how to use evidence-backed tools to keep your clinical edge without letting anxiety run the show. If you've ever thought, I can't relax because I'll miss something, then you're in the right place. But first, let's take a minute and talk about how medicine became such a fertile ground for anxiety in the first place. In medicine, the very qualities that make us effective, perfectionism, hypervigilance, relentless self-criticism and doubt, are amplified by our training and our work environment. In short, we're taught to be anxious. We're rewarded for spotting rare signs and replaying every choice, habits that keep patients safe but hijack our downtime. You clock out, but your brain stays clocked in. A Hazelden Betty Ford survey found that 80% of US doctors report severe stress or burnout, yet vulnerability is rarely discussed. Many of us brush off anxiety as fatigue or normal until it's something more serious. Ironically, the same neural wiring that helps you catch subtle changes in a patient's condition can also cause you to fixate on every minor error. High-functioning anxiety means you excel outwardly while secretly waiting for someone to find you out. This imposter syndrome affects up to 50% of physicians, fueling a cycle of self-doubt, anxiety, and isolation. Medical culture intensifies this. We're expected to work through illness, skip meals, and push through exhaustion, as if needing help is weakness. Over time, chronic stress becomes background noise until panic attacks or sleepless nights feel normal. And your brain? It can't tell the difference between a code blue and a late night urgent email. The same alarms that protect your patients keep blaring in your downtime. So let's fix that. Let's unpack what's happening in your brain when anxiety takes over. We're going to revisit neuroscience here a little bit. Your amygdala is like an overzealous alarm system. It jumps to red alert before your thinking brain even catches up. A perceived stressor, whether it's a crashing patient or a missed lab or a missed phone call, fires the amygdala, bypassing the prefrontal or thinking part of your brain. Prefrontal cortex. Your hypothalamus activates fight or flight, epinephrine surges, your heart rate spikes, and your muscles tense. All of this is great in crisis, not so great when you're laying awake at night replaying conversations from rounds. The bad part, if stress is constant, your cortisol levels stay high. And over time, this can shrink your hippocampus, the brain's threat context filter, making small stressors feel like emergencies. In short, your brain loses the ability to tell what's a real stressor and what's a daily annoyance. Some studies suggest that your brain even links adrenaline with productivity, that last-minute focus before a deadline. In medicine, that urgency can feel rewarding, but it's training your brain to crave stress. The result? Your sympathetic nervous system stays in overdrive, treating every task like a life or death situation. Sound familiar? I've got your back. In a few minutes, I'm going to share 3 quick resets that you can use, even between patient notes, to interrupt the cycle and stop the spiral. How many times have you thought, if I don't triple check this, someone could die? In medicine, that belief feels logical, even noble. But perfectionism quickly turns from patient safety to personal liability. We set impossible standards for ourselves while giving colleagues more grace than we give ourselves. Even a minor oversight can cause an internal spiral that leads to catastrophic thinking. That's not just thoroughness, it's a maladaptive perfectionism and high-functioning anxiety. Nearly half of physicians report imposter syndrome, crediting success to luck, not skill, which fuels over-preparation and burnout and keeps that anxiety loop going. Research shows that physicians who accept imperfection actually make fewer mistakes. The goal isn't lowering standards, but recalibrating them. So ask yourself, would I judge a colleague this harshly for the same thing? Naming the cycle is the first step. Breaking it requires daily tools that retrain your brain, which we're going to get into next. When anxiety feels built into your clinical instincts, the key is to respond differently. You can't really eliminate the stress, and honestly, we don't want to. So here are 5 tools that will help you reframe those anxious thoughts. The first is thought labeling. This approach is rooted in cognitive behavioral therapy. When a thought pops into your head and you start to notice the tension and worry building, Challenge it by saying, "Would I say this to a colleague?" Then label it for what it is. Just a thought, not a fact. The next is square breathing. Relaxation techniques aren't just about feeling calm, they're about interrupting your body's stress response before it spirals, about reprogramming that neural wiring that happens during medical training. Square breathing is a great way to hijack your stress response when it takes over, and it's easy to do in the clinical setting. It's simple. Inhale for 4 seconds, hold that inhale for 4 seconds, exhale for 4 seconds, and hold the exhale for 4 seconds. Repeat this for about 90 seconds. It's quick, it's discreet, and it's even endorsed by the CDC. Next, schedule a little bit of time to worry. Worry is normal, and it's actually sometimes healthy. And although it might sound weird to schedule some worry time, it's actually a powerful way to contain intrusive thoughts. So set aside 10 minutes each day to write down your worries. Give yourself time to listen and think about your worries. Then, outside of that window, tell yourself, "I'll deal with this later." Research shows that this method reduces intrusive thoughts in high achievers by about a third, making it easier to focus during the rest of your day. Next is just cognitive reframing. When thinking, "If I don't recheck this chart," ask yourself, what is the actual evidence that I've missed something important? This isn't about lowering standards or decreasing patient safety. It's using the same analytical mindset that you apply to patient care on your own anxious thinking. And finally, try some progressive muscle relaxation. Tense and release each muscle group for about 5 seconds, signaling to your body we're not in crisis, and taking over some of that fight or flight response that just happens automatically. By using these evidence-backed tools in your day, you're not just managing anxiety, you're laying the groundwork for a different kind of practice and a different kind of life. So, instead of letting anxiety call the shots, you can train your mind to use it as a tool for better practice. The sustainable clinician isn't someone who never feels anxious, it's someone who recognizes anxiety for what it is, information, not a verdict. Start by reframing your anxious thoughts. When your mind starts spinning with that what ifs, pause and ask, what is this feeling telling me? Sometimes it's a reminder that you need to rest or that a case hits really close to home. By treating anxiety as data, you can respond thoughtfully instead of reacting out of habit. The 80-20 rule is a practical way to put this into action. Quality research shows 80% of outcomes hinge on just 20% of efforts. In practice, this means focusing your attention on the most critical decisions and tasks. Spend your energy where it matters, like a tricky diagnosis or the sickest patient on the unit, while letting go of perfection on routine notes or administrative details. Maybe forget about a couple of those typos in your notes. You're not really cutting corners, you're making space for what truly impacts patient care and your own well-being. Building failure tolerance is just as important. Start by allowing one chart to wait a little bit. Notice the impact, and gradually give yourself a little more margin. It retrains your brain that missing perfection won't harm patients. Over time, you'll find that accepting small imperfections doesn't lower your standards. It actually makes you more present for the things that matter and less fatigued, because you just give your mind a little more room, which research shows actually leads to fewer errors. Next, when anxiety spikes, have a script ready. Try saying, "My brain is protecting me, but this is not an emergency." Medicine is full of non-urgent or emergent pages and messages. Learn how to sort those out and filter them away from the truly urgent or emergent situations. Or remind yourself, I've been in this situation before, I can do it again. These short phrases ground you, acknowledging the anxiety without letting it spiral. Time blocking is another tool that helps you set boundaries. Give yourself a set window for tasks like charting or emails, and when the time's up, move on. You might not have all your charting done, you might not have all your emails done, but you put your effort in for that allotted amount of time. At first, you might worry that you missed something, but your brain will adjust. Most tasks don't need endless revisiting, and this discipline frees up mental space. Finally, talk to your peers. Peer support can make a huge difference. Find colleagues who get it and talk openly about uncertainty. When you realize others share your doubts, the shame and isolation shrink. Medicine is so full of high expectations, but you don't have to face the pressure alone. These small steps add up. You can keep your edge and keep your well-being intact. Anxiety fuels vigilance, and we're taught to be vigilant as physicians, but learning to manage it is what sustains resilience. So, your takeaway tools from this: spot anxious thoughts with cognitive behavioral therapy techniques, use a quick reset with square breathing, and use the 80-20 rule to focus where it really matters. Now I want to hear from you. If you've tried one of these resets, drop a square breath in the comments. Or share your own quick anxiety interrupters that you use on a daily basis so other clinicians can learn from you. And if you want more tools to thrive in medicine without burning out, hit subscribe, turn on notifications, and join the Developing Doctor community that's redefining excellence in healthcare. Thanks for watching.